Hello, I am Valerina Daniel. Today is November 12, 2023. Indonesia celebrates the 59th commemoration of the National Health Day. Early this year, Minister of Health of the Republic of Indonesia, His Excellency Budi Gunadi Sadikin, spearheaded the national health policy reform through the passing of the new healthcare law. This marks an opportunity for Indonesia to upgrade its healthcare system and break through the middle income trap by increasing the quality of its healthcare system and the coverage for its population. And here with us today, the Minister of Health of the Republic of Indonesia, His Excellency Budi Gunadi Sadikin. And today, Minister Budi will share about his perspective on the much-needed reform of the Indonesia's healthcare system. So, Minister Budi, thank you for being with us today. Okay, so in regard to the new health law, what is the difference between this new health law compared to the previous one, and what does it offer for the betterment of our healthcare system?
The main reason why we push for a new health law is because Mr. President is really asking me to make sure that we do a major reform in healthcare sector to provide easy access, good quality, and cheap healthcare services for all people across the nations. So easy access, good quality, with a reasonable price. So that is the objective of this health law. And then we try to identify what the problem is with the existing situations, compared with the objective. We realize that access is a big problem. So access here in Indonesia, healthcare services is only for the privileged one. Healthcare services is only for people who live in the cities. Healthcare services is not for people that live outside of the city in the small villages or remote islands. And it is very difficult for poor people to get access, even a standard access of healthcare services. And we identify what are the problems. The problem is because we don't have enough healthcare facilities. And healthcare facilities are concentrated on the curative side to cure sick people. Whereas healthcare services' primary objective is to maintain people healthy. Because when you got sick, it is more expensive and it is it's a bad quality of life if you have to be treated at the hospital. Nobody wants to stay at the hospital, how good the hospital is. So we changed the strategy, put into the law that our focus will be on promotive and preventive, not on curative. Our focus is the upstream of the problem, not the downstream of the problem. Our focus is to revitalize the posyandu, the puskesmas, the healthcare of the public in that particular locations, not to cure sick people. You have to focus on hospital, to focus on the specialists, to focus on expensive medical devices. So that is a very major shift, and put our money into these promotive and preventive actions. So that is on access. In terms of quality, we realize that the fact many Indonesian people, it's not only rich people now, even the middle class is going abroad. So the reason why, because they don't have any confidence that if they're being treated in Indonesia, they will get as good quality as they're going to Malaysia, or they're going to Singapore, or they're going in Thailand. So that is becoming a problem. Because if Indonesian people don't trust the system, then it will be very difficult to regain the trust. So that's why we would like to increase the trust. And we identify one of the biggest problems is because we don't have enough doctors, we don't have enough specialists. So the good doctor, they have to see 100 patients, 200 patients every day. So their consultation time is very, very short. 2 minutes, 3 minutes, 5 minutes. So the people that consulted with them, they don't feel that they're having enough attention. And because of the time is very, very short, because we don't have enough doctors, then they feel that the quality is not as good as when I go abroad. So that is the quality. In terms of price, the issue is, this is the sector where information transparency or asymmetric information happens at the worst scale. I can give you an example in finance, because I came from finance, so I can compare with finance. If you want to exchange rupiah to US dollar,
Yes.
you go to every money changers or banks, the difference of the price will not exceed 20%. You go, this is 16,000 for every US dollar, here is 60,100 or 15,900, but the price difference will not be so big. Why? Because the information is transparent, so information is symmetric, can be accessed and can be understood by people. The same thing when you want to buy stocks or bonds everywhere globally, it will be the same. Now the issue is, in healthcare sector, it's not the case. You want to buy a medicine here, you buy a medicine in Malaysia, the price is 3 times more expensive. You want to do a small procedures like circumcisions in puskesmas, go to a private hospital, the price can be 5 times or 10 times more expensive, because the information is not there. So we do massive digitalization data, transparency, regulations of the pricing and standard services to make sure that good access, easy access, good quality, and reasonable price.
All right, thank you for explaining to us about the new health law. Now, you also mentioned about this new health law can transform the approach to the healthcare system from curative to preventive. Can you explain more about that? Can you maybe explain to us what is the concrete way of giving the example of that?
Curative means you go to hospitals. You got sick. Preventive means you stay healthy and you can live normally like we are talking now. So when I joined this position, 80% of my time, 80% of my budget are spent on curative side. I talk about hospitals, I talk about doctors, about specialists, medical devices, expensive, medicine. But I spend less time and less money to the puskesmas, to the posyandu, to screening, to educating people how to live healthy, to give immunization program to prevent for sickness. And by the way, when I see, the SDG, Sustainable Development Goal target, which is like a beacon for every healthcare professional, it says very, very clear. SDG 3, which is related with health target, is to promote healthy lives and well-being for all people at all ages. There is no such a word to cure sick people. And again, I met with 20 health ministers, APAC health ministers, also G7. All the title of ministers is health ministers. So their job is to keep their population healthy. There is no such a ministry in any country that sickness minister. There is no such a word. So that is the reason why we have to maintain healthy people, and we have to switch our time and focus on educating people, promote it, and do action to prevent, which is screening, lifestyle, and also immunizations.
All right, so we also know that next year Indonesia is going to have a new government after the election in 2024. So how can we make sure that this transformation process continue and after that period?
So the first thing that I'm doing, we revamp the law, because law is a very fundamental and live very, very long. So it's not easy to change the law. So that's why we revamp the law, the healthcare laws. Hopefully it will stay for 10 years or 15 years, used as a legal base for the future activities and protect the healthcare system, the healthcare professional, the health ministers for any significant change in course of actions. So that is something. The second thing that we are doing also, now we are getting the loan, long-term, 5 years loan, to implement the system. When you get a loan to build something, then the bank will make sure that during this period, the project stays on. If you build a house, if you're using cash, and suddenly you don't have money, you can stop the project. But if you borrow money from the bank, you cannot, because the bank will chase you to make sure, and the money will come from the bank to make sure that this executions of your program stays for 5 years.
Okay.
And number 3, the initiative that we are doing, it depends on the people. So we also do internal bureaucratic reform in Ministry of Health in Republic of Indonesia. We try to put young people, fresh ideas, good integrity and professionalism to take a key positions. So these people, I believe, will protect the sustainability of these programs.
All right. So I also know that we have this new health law because it gives us also an opportunity to improve our healthcare system and also the human resource. One of the ways to do that is by allowing or giving more opportunity for people to create vaccines, for example. Yes, and then so we're going to talk about that later after the break. So stay with us on TV Our World. We're going to continue our dialogue with the Minister of Health after the break. Hello and welcome back to our dialogue with the Minister of Health, Minister Budi Gunadi Sadikin. We are going to continue our talk about the vaccines development, which is one of the things that this new health law is going to provide more to the healthcare people in Indonesia. So talking about vaccines, we probably going to maybe remember the experience of Indonesia in handling the COVID-19 pandemics, where you as the minister at the time has to be able to secure vaccines for the Indonesian people. Maybe before we talk about the vaccines development plan in the future for Indonesia, can you maybe revise to us or maybe tell us more about your experience when you're able to secure the vaccines for the Indonesian people during the COVID-19 pandemic? Because we know that you have to compete with other countries. Can you tell us more about that?
My experience in this vaccine-related thing started when I was the Vice Minister of State-Owned Enterprises. Because at that time, I helped Pak Erick Thohir as a minister. And one of my portfolio is the pharmaceutical groups of state-owned companies and the hospital groups of the state-owned companies. So at the beginning of Pak Erick Thohir terms, we established a holding companies of pharmaceutical state-owned companies, Bio Farma, Indo Farma, Kima Farma. That happens, I think, in the first 3 months. And I was the vice minister that is given this responsibility by Pak Erick Thohir. And then during the course of the actions, I was asked also by Pak Erick Thohir to finalize the merger of 70 hospitals in state-owned enterprises. So I don't know why, but I manage these healthcare-related state-owned companies with thousands of workers. And during this period, when COVID-19 hit, of course, then Pak Erick asked me to fix this COVID-19, including looking for vaccine. Actually, at that time, the first opportunity came from AstraZeneca, because we try to approach the Pfizer or Moderna. Maybe we are developing countries. The opportunity is not so big. They give it to other countries first. But then we get access to AstraZeneca, and at the same time, Bio Farma work with Sinovac in China by themselves. So these are the 2 options, the first 2 options that we have. And at that time, they are not available. I mean, they are not clinically proven that they can be used. So it is very early in the beginning, and nobody is convinced that these are the way to go. Many people still pessimistic that, hey, this vaccine can be used at the end of the day. So then there is a progress, and then when I became the health minister, we finalized the deal. So we get access to those vaccines, and then when we get access to Sinovac vaccine first, after that followed by AstraZeneca, then the other vaccine manufacturing companies see, oh, they're serious, they have money. So then they are coming to us. So that's why then we strike a deal with multiple vaccine manufacturing companies. And during that time, globally, there is an initiative led by Gavi, the Global Association for Vaccine, and then they procure a large volume of vaccine and distribute to low and middle income countries. Indonesia, one of the recipients. So out of 450 million vaccine, I think about 150 is a grant basis. So we don't have to pay, but we get it.
All right. So based on your experience, you also learned that thanks to the grant, but other than that, you know that developing vaccines costs a lot of money. So that means if we are going to produce our own vaccines in the future, do you have plans in how to finance the process?
When the pandemic happens, we only have one vaccine company, Bio Farma. It has been there for ages. But now, I don't know whether people realize we have 3 vaccine manufacturing. 2 private sector. One is Biotis, and the other one is Etana. Bio Farma can, there are 4 types of technologies in vaccine. The old technology is virus-based or protein-based. Bio Farma can do it. But 2 next generation technology of vaccine manufacturing is vector-based technology like AstraZeneca, and also mRNA-based technology like Pfizer and Moderna. These 2 technologies, Bio Farma cannot do. So now these 3 vaccine manufacturing company can do the 4 technologies. So we have it. Questions always happens in many countries. It is unsustainable. The business model is unsustainable. Why we have a vaccine manufacturing companies, whereas the usage of vaccines is typically government initiated for immunization program, or if there is a pandemic. But pandemic happens every 50 years, 100 years. So it's not justified to build a vaccine company. My argument is, yes, it is justified as long as they are built in the large population. So like Indonesia, we have 5 million babies every year. So these 5 million babies, in the first 5 years, so 25 million babies, right? Because every year we have 25 million babies need immunizations. So if we build the vaccines in Indonesia, from the business perspective, it will be justified.
Okay.
Because every year we will need at least 25 million vaccine. But if we build in small country, like example in Singapore or Brunei, they don't have enough populations. So there is no mandatory procurement of vaccine. So that is the reason why we need to develop, sustainable, financially sustainable vaccine manufacturing operations in the large population countries.
Okay, so if the government decided that they are going to continue this plan to create vaccines for Indonesian people, what is going to be the priority? I mean, what kind of sector or aspect that is going to be considered?
From my perspective, vaccine is a preventive measures. I mentioned to you that every Ministry of Health in every country, the job is to maintain healthy populations, not to cure sick populations. So the primary should be there. So to maintain healthy population, we have several initiatives. One of them is you have to educate the lifestyle, to eat well, to exercise well. That is one part of it. Second part of it, you need to do active screening. So you identify your sickness earlier, whether it's breast cancer screening, colorectal cancer screening, hypertension, diabetes, everything. But number 3, you have to do immunizations. Because immunization means you prevent. If the disease is attacking you, then your antibodies, immune system can respond properly. So how we prioritize what vaccine will be implemented? For me, it's very simple. The diseases that kills most people, that is the disease that we will look for vaccine.
For example?
Oh, number 1 and number 2, the diseases that have infectious. You can transmit the diseases rather than it coming from you, but by yourself, your lifestyle, is something that we need to give vaccination to stop the spread of the infections of the diseases. One example that we don't have, or we have the vaccine but an old vaccine, tuberculosis. tuberculosis kills thousands, 1 billion people in the world. So that is the one that we need to have a vaccine. But unfortunately, the vaccine is very, very old and the efficacy is low. So Indonesia actually will do 3 clinical trials for new tuberculosis vaccine. I give you example diseases that doesn't have the vaccine yet. HIV. HIV doesn't have a vaccine. It is infectious. So we will look for potential HIV vaccines. Malaria. We don't have malaria vaccines in Indonesia. There is new malaria vaccine in Africa, but there's different type of mosquitoes. So this is something that we would like to do. Dengue is under vaccines. Now, that is for infectious diseases. For non-infectious diseases, new technology also provide new vaccine opportunity. Like example, cancer. There are a lot of immunotherapy, It is like a vaccine. Basically, it trains your immune system, to attack the enemies if the enemies are coming to you. The enemies can come from outside, like pathogen, virus, bacteria, or the enemies come from yourself, your cell or your protein mutates, change, and become cancerous. So we can train our immune system to attack them too.
We're going to definitely look forward to this kind of development in our healthcare system. So we're going to continue our talk later after the break with maybe talking about your background more. So we're going to continue after the break. Stay tuned on TV Our World. Welcome back to TV Our World. We are still talking to the Minister of Health, Republic of Indonesia, His Excellency Budi Gunadi Sadikin. So, Minister Budi, we heard your explanations about the healthcare system, and you sound very convincing in explaining everything. But we also know that your background is actually not from the healthcare system. So, how do you manage that?
When I had the first G20 meeting in Italy and sit there with my fellow G20 health minister, and I checking their background. What is your background? Are you a medical person or not? It's more than 70% are not coming from medical background. So I don't feel lonely. Yes. I remember at that time the health minister from UK was a bond trader of Deutsche Bank. So he has the same background like me in finance. So it's very, very funny. And then I check again, like example, in United States, the health minister is a district attorney, a legal person. In Japan, the health minister is not also a medical person. UK, they change health minister quite often. But now the health ministers, again, is not a health person. Even I'm very close to Singapore, because Singapore is one of the closest country. Singapore, even the health minister, always never a medical doctor. I discussed with some of them, especially my Singaporean friends, and there are some reason. I think doctor is very specialistic. So when you see one positions, usually they are very specialized. So sometimes you need impartiality, you need overall view. Which one you need to make decision on. So coming from outside, sometimes is more independent. It is more impartial. It's like football player. Okay. The commentary usually is given by somebody, not a football player, from outside watching the TVs. But they can give a commentary better than the actual players in the field, right? Because they are outside. They are outside of they can see the overall games, they give comment, they know the other players, they know competitors. Okay. Maybe one football player hate another country football player, so they don't want to give a good comment. But this guy outside, that give a commentary on the football games, they can give a more impartial and independent view on things.
All right, so
that is maybe one of such a thing.
Learning from your experience, so maybe we can say that even though we know that maybe Indonesian people doesn't have enough human resources in the healthcare system, for example, to support the new healthcare law development or implementation. So do you think we ready with this situation?
Yeah. To be honest, if we talk about the quality of healthcare services, there's still a lot of homework that we can do. But at least now we are very, very clear what we have to do. We are very, very clear how much money that we need to do it. And we are very happy because there is a fundamental law that can be used for us to do the programs that we need. Again, my focus will be more promotive and preventive to keep people healthy rather than cure sick people. And again, being 280 million populations live in 7,000 habitat islands, we need to make sure that good access or easy access, good quality, and reasonable price principle is always there.
Okay, so that means you know what is the most important thing that we need to do then. So based on your experience, so what is the first thing that needs to be done by the future Minister of Health, for example?
You know, health is very important determinant for Indonesia to become a high-income country. Our president, Pak Jokowi, keeps saying that we want to be a golden country by 2045, right? Basically, a president and every Indonesian want to be a high-income country. Mau negara maju, developed countries. Definitions of high-income country is your average salary should be 13,000 US every year, or average is 15 million rupiah a month, average. We are now at 4,700 per capita income, or 5 million per month. So we need to multiply by 3 times the average income. How can you do it? You can only do it to break the middle income trap and go to high income countries if your people are healthy and smart. So that is very important. The Minister of Health and Minister of Education is a very important post to fill with professional people to make sure that during the demographic bonus, where the opportunity for every nation historically to move from middle income to high income is the biggest, because we have many productive population, you need our people to be healthy and smart. So that's why it's very critical. The demographic bonus will happen 7 years from now. 2030 is a very short period that we can establish a very strong national healthcare system and national education system for our next generation. Otherwise, they will live forever in middle income country.
All right. So next year, unfortunately, your term will be over. We don't know what's going to happen in the future, but what is next for Budi Gunadi Sadikin?
I will be 60 next year. In Indonesian, systems, 60 means retirement period. 60 years old means elderly category. 60 years old means that you have everything for life. Your KTP is for life, your SIM is for life, whatever is for life. Everything should be discounted, right? That should be a discount to enter the museum for elderlies. There should be a discount to take a bus or MRT for elderly. So it means that as an elderly, you have to enjoy life. So I think I would like to enjoy life. And so, Budi, you need to have a job. One of the jobs that I enjoy is actually becoming an ambassador. And I love to be an ambassador of Japan. Like I used to live in Japan.
Which country, if you
Japan.
may?
Japan.
Oh,
Because I live in
why
Japan.
Japan?
I live in Japan for 1 year. I love the country. I love the food. I love the weather. I love the culture. I know a lot of people when I was in banking. I believe I can get connected to Japanese people closely. I know the businessmen in Japan, and I think I can still contribute with much less pressure than become in this position.
Thank you very much. We're definitely going to miss you at that time. So hopefully you're going to be more successful in the future. Thank you, Minister Budi Gunadi Sadikin, for sharing your thoughts and also your plan with TV IR World.
Thank you.
All right, that was our talk with the Minister of Health of the Republic of Indonesia, His Excellency Budi Gunadi Sadikin. I am Verena Daniel. Thanks for watching and goodbye.